Pediatric echocardiography is the gold standard for diagnosing congenital heart disease. While the field is vast, 3 lesions every clinician, from neonatologist to family practitioners, should be able to recognize on an echo report or clinical presentation. Ventricular septal defect is the most common congenital heart lesion, accounting for nearly 30% of all congenital heart disease. It consists of a hole in the septum separating the left and right ventricles. On echocardiography, the hallmark is a high velocity jet of blood crossing from the left ventricle, which is at higher pressure, to the right ventricle, which is a low pressure chamber, during systole. Look for left heart enlargement, left atrium and left ventricle dilatation on the report. This indicates volume overload because the extra blood sent to the lungs eventually returns to the left side of the heart. Small VSDs often produce a louder murmur, harsh, hollow systolic. Loud, harsh murmur of small VSD is called malady de Roger, and the reason is the high pressure difference between the ventricles and the blood passing through a tiny hole, which causes more turbulence. The reason why small muscular apical ventricular septal defects can have short murmur and soft murmur is because the defect gets closed midway through systole due to contraction of the ventricular muscle. That is why apical small VSDs or tiny VSDs may have a short, soft systolic murmur heard at the apex. That is often seen in very small children. Tetralogy of Fallot is the most common cyanotic congenital heart disease, often manifesting as blue baby. It is a conotruncal anomaly, meaning that it stems from a single developmental error in heart's outflow tract. It can be defined by 4 classic features, often remembered by the acronym PROVE. 1. Pulmonary stenosis, or rather right ventricular outflow tract obstruction. 2. Right ventricular hypertrophy. 3. Overriding aorta. The aorta sits over the VSD instead of the left ventricle. 4. Ventricular septal defect. In echocardiography, hallmark is a large malalignment VSD with the aortic root straddling or overriding the septal crest. The severity of child cyanosis is dictated by degree of pulmonary stenosis. The